With the COVID pandemic, we have been transitioning to a lot of telehealth resources for patients in general. And we thought that this would also be an ideal program for our patients with COVID. There are obvious challenges having a patient with an active infection following up in an outpatient setting. So how can we deliver those resources to the patient in a way that is safe for them and for everyone else? What has been coming out with COVID patients is it's not just that you get a respiratory infection and then you get better and it's done. What's coming out is that you get the infection and a lot of people have other areas that are affected. The truth is more complicated, and it is great that they made it through their ICU stay, but they may have many other things that we need to work on for them to return to that full life. And the recovery is often much longer, and there may be other complications to that recovery. There are many domains that are affected, but some of the main areas are, one, people have symptoms with their breathing, so they can have what's called dyspnea or feel short of breath. Two, there's the cardiopulmonary endurance, so you're short of breath, but you're also not able to walk very far or move very far or have endurance for activities that we kind of take for granted. Other areas are your physical functioning, so self-care, ability to take care of your daily needs. So, can I dress, bathe, groom, feed myself, those kinds of things. Other things that we're finding is that people have cognitive changes, and then emotional or mental health issues that follow, including anxiety, depression, PTSD. And all of that combines to be a patient that's much more complicated than just simply, you can call them up and say, hey, how you're doing. We really want a comprehensive service to be able to be delivered to that patient to address each of those domains. The advantage of telehealth is that you're seeing the person, you're seeing their environment, and there are things that you can do with a telehealth visit that you can't do with a phone visit. So, for example, I can have the patient march in place or do sit to stand exercises so I can see how they're functioning. I think there's also a human component. So when I'm asking you questions about your mood or whether you're having, flashbacks to the ICU, it's just better to be able to look someone in the eye and ask those questions rather than by telephone. The goal is partly to understand the disease itself, what percentage of people are going to have more severe symptoms and need this kind of follow-up, and what could do fine with just a home exercise program and some education. This is actually a need that's been identified in a lot of ICU survivors, and I think building this clinic out to serve their needs as well, whether or not they've had COVID or something else like a pneumonia or an influenza, something like that, I think this clinic can serve that need well too.